Again, I'm Geraldine. I'm a registered dietitian, and Teresa and I are colleagues. So we put together a little presentation, and we're going to leave some time for questions, answers, discussions. And we're going to talk about cystic fibrosis and nutrition and longer life expectancy.
This actually, just before we start, this has been like a hot topic around our clinic. So that's why we thought this presentation would be a wonderful thing to talk about.
And we hope that you can help us too as providers to help us learn so we could continue to provide the best care that we possibly can for you. All right. So the historical cystic fibrosis diet has always been an emphasis on high fat, high sodium or salt intake, and calorie or energy needs for CF are typically 1.5 to 2 times higher than that of someone without CF. So this is related to malabsorption from pancreatic insufficiency, frequent infections, and increased work of breathing, and to maintain or promote weight gain towards an appropriate body mass index, which is the proportion of your height and weight. And it's been published in the literature and the research to correlate with breathing function. So now we have these CFTR modulators, which many people could be on, and they're really quite wonderful in many ways. So there's Kalydeco, Orkambi, Symdeko, and Trikafta. And for many people, hold on, let me get rid of this. For many people, there we go. For many people taking these medications, there is improvement in lung function, there's better absorption of nutrients, weight gain, and the best part is longer life expectancy. So we want to focus a lot on CFT modulators and weight gain, which has been something many people have experienced on it. So with weight gain, there is an increased risk of obesity because there's better absorption and utilization of your nutrients, of your vitamins, of your minerals, and your calories, carbohydrates, proteins, and fat. And calories is the same thing as energy. So with weight gain and CF, it's contributed to longer life expectancy because, like we said, with the BMI and better breathing function. However, it's increasing occurrence of overweight and with the modulators. So the goal is to achieve and maintain a healthy weight.
So like, right. Oh yeah. So this is where I was going to butt in about BMI. So basically what Geraldine was saying, we use BMI to determine what is a healthy body weight. So if your BMI is under 18, you're considered underweight. Between 18 to 25, it's a normal. Overweight is 25 to 29, and obese is over 30, and extremely obese is over 35. And we look at these numbers because we see that with women who hold a BMI around 22, they have better lung functions, they're not getting as sick as much. And for men, their BMI around 23 is more ideal as well. So we're not seeing them get as sick and they have better lung function. So what are the risks associated with obesity and longer life expectancy? As we age, we're at risk for diabetes, cardiovascular disease, high cholesterol, hypertension, which is your high blood pressure. When you go into your clinic, I'm sure your RD looks at your A1C, which is an average of your blood sugar over the past 3 months. They look at your lipid panel where they talk about your LDL, your HDL, your cholesterol, your triglycerides. So these are all important. So diabetes, it's a disease which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates, and it elevates levels of glucose in the blood and urine. Why is it important to prevent diabetes? Because it can put you at risk for impaired vision, retinopathy. It can affect your kidney function. It can put you at risk for stroke, heart attack, and vascular disease. So, I'm sorry, you want to?
You got, go ahead, you go.
You can do the next one. So someone with CFRD, cystic related diabetes, they need to take insulin because we see from studies that oral medications are not effective. I was actually reading into this because I was always interested in why they use insulin and not oral medication. And it seems like, correct me if I'm wrong, Jarlin, it seems like it has to do with like the insulin resistance, and oral medication doesn't really affect that. So you need insulin in that.
Right. So it's kind of CF related diabetes. It's its own sort of form of diabetes, because there's type 1 and there's type 2, and we won't go into the whole jargon of it because that's kind of, another topic of conversation. But with diabetes in general, it's either your body isn't producing insulin, isn't producing enough insulin, or isn't using the insulin effectively, and it's resistant. So with CFRD, it's a little bit combination of all of the above. So oral medications don't target CF-related diabetes as much as insulin. Insulin, everyone's body has it or doesn't. If you don't have it or don't have enough of it, you need it to survive. You need it to maintain your blood sugar. Because if you don't have it, when we eat carbohydrates, it's not going to get into our cells. And if it doesn't go in the cells in your bloodstream, it's in your blood. And then you have high blood sugar. And that can do damage to your body over a very prolonged period of time if those blood sugars are not maintained as much as possible. So often we'll refer people to a specialist known as an endocrinologist, and often diabetes educators. That can be a nurse diabetes educator, a dietitian diabetes educator, and they do a variety of things from nutrition to insulin administration, testing blood sugars with glucometers, and they are certified professionals just for that. So the next risk is also cardiovascular disease. So high cholesterol can increase your risk of heart disease. And there's different types of cholesterol, which Teresa had briefed upon. So you have HDL, which is good cholesterol, and LDL. Most cholesterol in our body is what you naturally produce. But diet and obesity and overweight can contribute to elevating those levels, as well as longer life expectancy. And that's for anyone, CF or not. So what happens when you have high cholesterol is it develops these fatty deposits, like you can see in this diagram, and it sort of clogs up the vessels, the arteries, and it makes it hard for blood to flow through. And if your blood can't flow through effectively over time, it can increase your risk for a heart attack. And we also have high blood pressure and hypertension. When your blood pressure is high, your heart is having to work harder to keep your pressure sustained. So it does increase the risk for stroke, and it can damage your kidneys and increase your risk of kidney disease. All right, you take it over, Teresa.
So the role of nutrition and eating healthy. So we talk about it's important achieving and maintaining appropriate weight. We talk about we want to basically reduce our risk for obesity, diabetes, and heart disease. So in ways we can prevent obesity and try to control our diabetes and heart disease is to focus on lean and low fat proteins, incorporating high fiber carbohydrates, I always tell my patients to eat the rainbow, so eat a variety of fruits and vegetables. Big thing when it comes to CFRD, I tell my patients the best thing they can do is to avoid drinking sugary beverages. There's no nutritional benefit from it. There's no reason for you to drink it. Water is best. And exercise, because exercise helps you maintain that good weight, and it's also good for your bone health as well.
And it helps you use the insulin in your body more effectively. It sort of boosts it up, if you will. Okay.
So as Jarlin was saying, we were wanting to focus on different types of fats. So we want to have more healthy fats. So those are your unsaturated fats, your monounsaturated and polyunsaturated. They're liquid at room temperature. They're normally made from plant products. So corn oil, canola oil, avocado oil, those are good things to cook with. You want to basically choose those types of fat in your diet. You want to have less of the saturated fat and trans fat. Saturated fat is solid at room temperature. It's typically found in like your meat products. I always tell people the chicken with the skin on it. I'm trying to think. I remember telling somebody and I was like, you gotta take the skin off the chicken. They're like, but that's the best part. It can raise your saturated fat, can raise your blood cholesterol. It's also found in butter, cheese, lard, margarine. And trans fat, which is normally called hydrogenated oil. It's typically found in a lot of baked goods, shortenings, many margarines. That's one of the fats I tell our patients to make sure you look at the label, look for that word hydrogenated oil, because if it has hydrogenated oil in it, it's going to have trans fat. Healthy food choices. So it's important to have fiber in your diet. Fiber traps cholesterol in your blood and basically excretes it out of your body, keeps you fuller for longer. It also helps with your blood sugar. A lot of times when I tell my patients with CFRD, I tell them make sure you're pairing that carb with something with fiber or protein. What food has fiber? Your whole grains, so brown rice, whole wheat pasta, whole wheat bread, beans, legumes, and fruits and vegetables.
So we wanted to just keep in mind that this is very general information, and always know that your registered dietitian and your CF care providers will individualize this for you. Because we could go into a rabbit hole of nutrition information with this, but
really in regards to like me and Jarlyn will have like conversations about like CFRD. We had such a good conversation this week in regards to CFRD and how we can better control it with insulin, how to be on top of that, with diet, with checking. We had such a great conversation, but it always goes back to every patient is different and every patient has a different nutrition plan.